In the high-stakes world of public health, tracking infectious diseases, well, it's a constant battle against an enemy you can't even see. And our single most important weapon in that fight? It's data. Plain and simple. Data tells us where a disease is, where it's headed, and, most importantly, how we can stop it. Which really brings us to the fundamental question, right? It's something every public health official on the planet has to ask themselves. How do you fight a disease you can't see? I mean, to stop any threat, you've got to be able to see it clearly first. So, what happens when your vision is just blurry? And that is the core problem we're going to unpack today. See, our entire global surveillance system, the whole thing, is built on a foundation of data. But here's the kicker. As the research shows, that foundation is often super fragile, it's incomplete, and honestly, it's deeply flawed. And that forces people to make these huge life or death decisions while, basically flying blind. So to really get why this matters so much, we've got to look at where the stakes are highest. Infectious diseases, they hit low-income countries the hardest. It's a massive social and economic burden. For the national disease control programs in these places, figuring out where to put their limited money isn't just some spreadsheet exercise. No way. It's about saving lives. And you just can't do that without good, accurate information. Okay, so where does this info even come from? Well, traditionally, it's all gathered through on-the-ground surveillance. But the thing is, that whole system is just riddled with weaknesses. The best way to think about it is like this. Imagine you're trying to navigate an entire country using a map that's blurry, incomplete, and looks like it was drawn by hand. Yeah, you can kind of see the general shape of things, but all the critical details you actually need, they're just gone. I mean, on paper, the process looks pretty simple, right? It all starts when a patient shows up at a local clinic. That case gets reported up to a regional or district center, and then, finally, all that data gets pulled together at the national level. That's the ideal flow, the way it's supposed to work. But the reality? It is rarely, if ever, that clean. Because in the real world, that data pipeline can break at every single step. Data from local clinics, it might be delayed for weeks or just never show up at all. Cases could be underreported because the staff is just completely overworked. Or, get this, they might even be overreported if funding is tied to how many cases you have. Now you add in really vague diagnoses like just fever and population counts that are maybe a decade old, and you start to see why the policymakers have almost no confidence in the very numbers they're supposed to be using to make these huge decisions. But then, boom. A technological revolution happens, and suddenly there's this incredible wave of powerful new tools that promise to fix that blurry map once and for all. Tools that can cut right through all that noise and give us a crystal clear picture of what's actually happening with a disease. And these aren't just any tools. They're being developed by some of the most brilliant minds out there in top-tier academic institutions, usually in high-income countries. And for a minute, it really seems like the solution has finally arrived. Like, great, we have the tech to solve this data problem once and for all. And seriously, the tools themselves sound like they're straight out of science fiction. We're talking about super high-resolution satellite imagery that can predict where mosquitoes are going to breed. We're talking about anonymized mobile phone data that literally shows how people and, by extension, diseases are moving around. And even pathogen DNA sequencing that can trace a whole outbreak back to its single original source. It feels like the problem of flying blind is finally over. So that leads to a really critical question, doesn't it? If we have all these amazing futuristic tools, why isn't our map of the world getting any clearer? Why aren't these incredible innovations actually being used to save lives out there on the front lines? And this is where we get to the real heart of the problem. It's captured perfectly in this one quote from the research. It says that for all this potential, very few of these tools have actually been translated into policy or scaled up. It's all getting lost in translation. There's this huge, massive gap between the world where these amazing tools are created and the world where they are so desperately needed. You see, it turns out we're really dealing with two completely different worlds, just operating in parallel, and they're not talking to each other. On one side, you've got academia. They're focused on super sophisticated methods, big global patterns, and they have access to all this big data. But then on the other side, you have the national health programs, the people on the ground. They're dealing with tiny budgets, a totally local focus, and healthcare workers who are already stretched to the absolute breaking point. And this is where the paper proposes a really powerful idea for a solution. It's not about choosing one of these worlds over the other. It's about building a bridge between them. And the term they use for it is productive disruption. So, what does that actually mean? Well, in short, it means you can't just parachute in some shiny new technology and expect it to magically work. No, it means new tools have to be designed with the people who are actually going to use them, day in and day out. They have to be embedded right into the systems that already exist, not just built in some isolated lab. And look, this isn't just some abstract theory. We have real world examples of this working. In Cambodia, for instance, malaria reporting got way better. Not because of some complex new algorithm, but because health workers got simple feedback using, get this, color-coded stickers. The timeliness of the data improved when workers could just report cases via a simple SMS text message, and were even allowed to use the phones for personal stuff. It's all about these small, smart, human-centered changes. And all of this, it all points to what might be the single most important takeaway from this whole thing. For so long, the focus has been on finding that one perfect technological fix. But maybe we've been missing the real solution all along. Because it turns out the solution isn't just better technology. It's not a more powerful satellite or a faster computer. I mean, think about it. The most advanced tech in the entire world is completely useless if it doesn't actually work for the people on the ground who need it most. No, the solution is about empowering the people on the front lines. The community health workers, the clinic staff, the data entry clerks. They are the true foundation of any effective health system. Technology has to be a tool that serves them, not the other way around. So what's the path forward? Well, it's actually pretty clear. It's all about collaboration. It means academics have to co-design these tools directly with local health workers. It means providing sustained training and resources, not just a one-off workshop. And it means that ministries of health and the big donors have to truly commit to integrating all of this, thoughtfully and for the long haul. And that leaves us with one final, pretty crucial question to think about. As we race to prepare for the next pandemic, we're all focused on vaccines and high-tech solutions. But what if the most powerful innovation of all isn't a piece of tech? What if it's simply bridging that human gap? The gap between the brilliant people designing the tools and the incredible people on the front lines using them to save lives?